Hello, my name is Dr. Ken Wallace, the co-founder of Notebook of Medicine app for doctors and other healthcare professionals. Notebook of Medicine is a social network for doctors. Using Notebook of Medicine, doctors will be able to access information on all diseases and their diagnosis and treatment in a logical way in a structured book. You are not only accessing specific information on that disease, but you are also understanding a logical way to consume the information. Take notes and upload images for that disease in the same book, so you have your own private notes and images next to that disease information forever. Your book grows as you take on more cases. You will be able to share this information with other doctors, share your clinical, pathological, and radiological images and comments on diseases, diagnosis, and treatments. While contributing to the shared knowledge, you will be able to be recognized in the healthcare community as an expert in that area. I would like to talk to you about why I've created Notebook of Medicine. If you ask most physicians if they were satisfied with their medical education, I suspect you would get a wide range of answers. Personally, for me, for the most part, I think the word you could use is confused. I just felt there was no logical structure to my education. I would ask my teachers to help me make sense of it all, and they would say, read the book. So when I rounded on internal medicine, they would say, read Harrison's. And I thought, you think I'm going to read all of Harrison's in 2 months? That's not going to happen. Then when I rotated on general surgery, they said, read Savastin. And I thought, you think I'm going to read all of Savastin in 2 months? That's not going to happen. When I rotated on pediatrics, they said, read Nelson's. And I said, you think I'm going to read all Nelson's in 2 months? That's not going to happen. I just wanted one book that had everything. Anyway, like most physicians, I had little grasp of what kind of doctor I wanted to be. I just wanted to, know everything. Aren't doctors supposed to know everything? But when I finished my medical school training, they said, pick an organ. And I said, well, what do you mean? Well, you have to pick an organ. You can't know everything. You have to specialize in one thing. So we have pulmonologists for the lung and neurologists for the brain, dermatologists for the skin, cardiologists for the heart. What kind of doctor do you want to be? I said, well, I wanted to be a doctor who knew everything. What kind of doctor knows a little bit about everything? And after they were done laughing, they said, that's easy. That's the emergency room physicians. Hence, my foray into emergency medicine. Emergency medicine was fun and exciting when you're a young man or woman. But at 40 years of age, a friend of mine had me spend some time with his father, who was a dermatologist. I have to admit, I had no idea of all the surgeries that the dermatologist did in their office. In fact, my first day when I was there, I was so confused. I was like, are you sure you should be doing these kind of surgeries in this office, not in a hospital? Anyway, it was, not only was it okay to be doing those surgeries, it turned out to be fun as hell. Hence began my foray into the world of dermatology. Of course, there was one thing I had to do if I was going to be a dermatologist. I had to sit for the derm boards. That happened in my life about 10 years after I graduated from emergency medicine. And so I had to sit for 2 boards at the same time, emergency medicine and dermatology. And guess what I got to do? I got to read the books. I got to read all the books. And guess what I learned? They were right back in residency. The information is in the books. The thing is that they all say the same thing with a little twist. Harrison talks about syphilis. The pediatric textbooks talk about vasculitis. The general surgery textbooks talk about vasculitis. The gynecology textbooks talk about vasculitis. They also talk about syphilis. And I started seeing patterns in all these books. And I decided to write an outline of sorts so I could keep all the information straight. Now, these patterns I discovered had three very important things. And basically, all diseases can be triangulated if you think this certain way. First of all, medicine is a sine wave of life. When melanocytes die, it's termed vitiligo. As they get bigger, it's termed a nevus. And when they get bigger and bad, it's a melanoma. When collagen is destroyed, it's called atrophoderma. And when it's enlarged, it's a keloid or hypertrophic scar. When elastin is destroyed, it's called elastolysis. And when it's enlarged, it's called elastoderma. When vessels dilate, it's called hypotension. And when they constrict, it's hypertension. The thyroid gland makes low thyroid. It's hypothyroid, either euthyroid, meaning it makes a normal amount, or hyperthyroid, meaning it makes too much of the hormone. Secondly, I noticed that everything in medicine comes in three embryologic divisions, namely ectoderm, mesoderm, and endoderm. So neuroectoderm, when it forms an enlarged mass in a normal location, it's a hamartoma. When it combines with mesoderm, it's a neuroectomesenchyma. So you would have an adenofibroma or an adenolipoma, a neurolipoma, or a neurofibroma. When mesoderm combines with mesoderm, it's a mesenchyma, so an angiolipoma or a neurolipoma. When ectoderm and mesoderm and endoderm combine together, that's called a teratoma. Thirdly, the bone marrow mesenchymal tissue makes certain cells. So we have histiocytes that go after foreign bodies, eosinophils that go after parasites, lymphocytes go after everything, neutrophils go after bacteria, lymphocytes go after viruses. Plasma cells make antibodies that go after your whole body. You have platelets, red blood cells, basophils, and mast cells. Now, when a neutrophil attacks mesoderm or endoderm or ectoderm, it has its own term. So when a neutrophil invades the dermis, it's called neutrophilic dermatitis or pyoderma gangrenosum. When it invades a blood vessel, it's called neutrophilic vasculitis. When it invades the pancreas, it's called neutrophilic pancreatitis. When it invades the optic nerve, it's called neutrophilic optic neuritis. When a neutrophil forms a mass in a neutrophilic leukemia, it's a myeloid sarcoma of the organ. Now, it can do this with eosinophils. When they invade the dermis, it's termed eosinophilic dermatitis or Wells syndrome. When they invade the blood vessel, it's called eosinophilic vasculitis, eosinophilic pancreatitis, eosinophilic optic neuritis. When histiocytes invade the dermis, it's called histiocytic dermatitis, histiocytic vasculitis, histiocytic pancreatitis. There's a histiocytic sarcoma and a histiocyte cell leukemia. Plasma cells make plasma cell myelomas, plasma cell leukemia, and plasma cell sarcoma. This repeats itself every time. Every cell line makes a lymphoma and a leukemia line. When antibodies attack the self, especially in the DE junction, it's called dermatomyositis, graft versus host disease, lichen planus, and lupus. Now, I realize this may sound a bit fantastical, but if you work this out, it works for all of medicine. It never fails. You see, there's only a limited number of organs with a limited number of things that can attack them. There's also a limited number of adjectives we use to describe what happens when a bone marrow cell line attacks an organ, such as necrosis, apoptosis, etc. If you can learn the 500 or so adjectives and apply them to this line of thinking, you can actually understand medicine. I'm not saying you will know it all, but if you could start your learning with understanding all of medicine, you would be a genius by the time you finish. At Notebook of Medicine, I have painstakingly worked all this out for you. Not only that, we've created an editable textbook which is easily searchable for every diagnosis in the world. Just type in a phrase like malignant melanoma-larynx and an ancestral tree will take you there, literally teaching you as it goes. Once there, you may enter the homepage for that to find an editable textbook. Here you can add text, photos, videos, etc. and post them to private, semi-public friends, public forums, and in this manner you can share your data with anyone you like. But the best part is that your thoughts for any particular diagnosis will always be in one place, no more taking notes and losing them. Think of it as we are a skyscraper of medicine, and you get to enter the furniture. Now you can only edit your own furniture and edit your own version, as it is your own personal edition. After all, I may not like the furniture you add, so each book is individualized according to what you learn and when. Like a record of your thoughts as you go through your medical education for any type of healthcare provider and not just physicians. In this way, all your thoughts on any particular subject will be forever stored in the same place, easily searchable and updatable as you like. The ironic part of learning is this: one cannot know the parts without knowing the whole, nor can one know the whole without knowing the parts. At Notebook of Medicine, we will give you the whole. The parts are up to you. We will give you a 30-mile view of the earth and a 30-mile view of medicine, and start you at the top of the pyramid of medicine and work your way down instead of dumping the pyramid upon your head and having you work your way up. And believe me when I say, it's always easier to go downhill. Hi.